Just give me 2 minutes.
Okay.
Good evening, everyone. On the behalf of Team DentistChannel.Online, I would like to extend a very warm welcome to all of you. I'm Dr. Aditi Mishra, and I'll be the host for today's session on the topic Introduction to BLS by Dr. Fatima Ali. And today's webinar is sponsored by Novamind Implants. So without further ado, and before moving forward, I have few housekeeping notes to make. If you have any doubts during the session, you can drop your questions in the question and answer box in your control panel, and each and every question will be taken up at the end of the session. If you have joined us from Facebook and YouTube Live, you can also ask us questions by commenting, and the you'll be answered at the end of the session. So without further ado, I would like to introduce our today's speaker to everyone. Dr. Fatima Ali is a resident physician specializing in emergency medicine. Previously, she has worked in the Department of Nephrology at Sahara Hospital in Lucknow. She's experienced as a BLS trainer. She is right now the second year resident of GW Fellowship. So, welcome, Dr. Fatima.
Hello, Dr. Aditi. Thank you for having me here.
Now, the stage is all yours now. You can start the session.
So the content is, I'm not able to share it. I think, why don't you go ahead, share it, and I'll speak on that.
All right, I'll do it.
Okay. So, hello, everyone. My introduction has already been given by Dr. Aditi. So, today I'm going to talk about adult basic life support system. Can you change? Yeah. So main objective is to try and understand and of course demonstrate is one of the most important thing is how you have to assess the collapsed patient or the collapsed victim. And then most importantly about basic life support system is doing chest compression and giving the rescue breathe and how you have to place an unconscious breathing victim in the recovery position. Yeah, Dr. Aditi. Okay. So this is just a small, like a chain of a diagram that is done basically in the basic life support system. So first you have to actually try and understand that what is the how you have to recognize and then whether your victim is collapsed, is unconscious or is conscious, and you have to call for help. You also have to try and prevent the cardiac arrest also. So my main thing or the main concept is going to be that any patient that you see is collapsed, first of all you have to understand that whether the patient is conscious or not. And the moment you see that the victim or the patient is unconscious, is not breathing, is having no pulse, then without any further delay you have to start early CPR. CPR full form is cardiopulmonary arrest. And can we go on to the next slide, please? Okay. So first of all, what is cardiac arrest? We need to understand is mechanical cessation of cardiac activity. There is no evidence of any cardiac output. Now, my main actually teaching is about the basic life support system. I don't want to go into what is a mechanical cardiac activity and cardiac output, but it's just mainly about basic life support system, about how to do CPR and the other things that are connected to it. So the signs of cardiac arrest is unresponsiveness, absence of detectable pulse, apnea or agonal respiration. Cardiac arrest is when the blood flow to the vital organs is very low. The vital organs, meaning it could the heart, lungs, brain, kidneys, these are all your vital organs. So I mean, if the loss of blood to these vital organs prolonged, then death is for sure. And if these things can be reversed very quickly, then survival without any loss of function is there. So the sequence of procedures performed to restore the circulation of oxygenated blood after a sudden pulmonary or cardiac arrest. So chest compressions and pulmonary ventilation performed by anyone who knows how to do it. anywhere immediately without any equipment. Okay, so these red highlighted marks are very important for everyone here who has joined, to know that what you have to do basically in basic life support system. Basic life support system, giving CPR, giving breathing, can be done by anyone, anywhere. Okay. Can we change the slide, please? Okay. So this triangle thing that you see is, here are the vital organs where you have to restore the blood. You have to maximize these organs with the blood flow. Imagine that you have to restore the heart and the brain circulation, right? To effectively and efficiently maintain the tripod of life, that is the brain, heart, and the lungs. Okay. So for doing CPR, these are the mnemonics that are made, which you will find in anything. There are so many certified programs being done by AHA, which is American Heart Association, given by BLS, or it's also given by it's also given for ECLS, ATLS programs, right? So always remember, you have to check the patency of the airway. B is for breathing, C is circulation, and D fibrillation. Defibrillation. Okay. So how you have to, first of all, main important thing is you have to approach the area. You have to see whether your scene is safety or not, because there are so many things in it involved. First of all, you have to make sure that you are safe. If you are safe, then only you can make the other person or victim or the patient safe. So you have to see that the approach you are doing is safe, the area is safe. Suppose if you find any person who is unresponsive or unconscious in the middle of the road, you're not going to immediately just start doing CPR there itself. You would have to bring the patient to the other side, to the other side of the road. Make sure that the scene is safety. You have to shout out for help and immediately start doing CPR. You also have to check the patency of the airway. Make sure that patient has not taken any foreign bodies, or if there is any occlusions in the airway. If you see if it is visibly seen, then you have to try take it out. You have to check the breathing. The breathing is basically done with two fingers or done on your carotid pulse, and you have to call for help. You have to do 30 chest compressions with two rescue breathings. Okay. So you have to approach safely. You have to see the scene, but as I've discussed earlier, and obviously you're going to find any bystanders over there. If you do find it, you have to shout for help to them, activate the AED system. And can we change the slide? Okay. So now that you have seen your approach is safe, you have to check the response of the patient. The response you have to check is by tapping on the shoulder. You will have to you will have to actually call out to the patient. You have to say, hello, hello sir, are you okay, are you fine? If you see that there is no response, then you have to immediately shout out for help. So shake the shoulders gently. You have to ask if the patient is all right, if he's responding. Leave as you have find him. You have to find out what is wrong with him. You have to reassess regularly, right? Next. You have to shout for help. Open the airway. So opening the airway, there is a technique to it. You have to chin lift and jaw thrust. Head tilt, chin lift, and jaw thrust. Next. Okay. So head tilt, chin lift is done by the lay rescuers. Now, basically, this is a presentation here, but this is basically done in a demo class where everybody gets a chance to do it. So it's just a video. I think if you can really appreciate it. Yes. Okay. So head tilt, chin lift, and jaw thrust is basically making you're actually setting the neck in certain angles where you will be able to actually open the airway and see whether the airway is patent or not. So here you can see that basically what happens, the first organ that actually falls back is the tongue. So you have to make sure by doing these maneuvers, you are actually making the tongue come into its position. So the tongue will not fall back. And so with this, you are able to actually maintain the airway. Check the breathing, whether the patient is breathing or not. You have to see tangentially whether the chest is rising or not. So call out for help. You have to look, listen, and feel for normal breathing. You do not have to confuse it with the agonal breathing with normal breathing, okay? You have to make sure that the chest is rising or not. Okay. So can we go to the previous one, or this is the one? Okay, so no, it's okay. We go back. Okay. So agonal breathing is basically after the heart stops. So it basically occurs in 40 to 50% of cardiac arrests patient. So it's a very heavy and noisy or a gasping type of a breathing, which is quite different from normal breathing. And you will be able to actually appreciate it only when you see it. So my saying or my telling in this presentation is not going to be of help. Probably in the future, if who all are here in the presentation ever gets a chance, would actually should appreciate and see by demonstrating it. So you have to recognize the sign of cardiac arrest as well. Erroneous information can result in withholding CPR from cardiac arrest victim. Okay, so next. You have to call for help. You have to tell any of your bystanders, call the ambulance, rescue 911, or in India, you have ambulance call for 121 or 211, wherever every state has a different ambulance numbers. And immediately, once you see that the patient is not responding, there is no breathing, you have to start with chest compressions. Remember, you have to do 30 compressions. With 30 compressions, you have to do 2 rescue breathing. Okay, next. So before, if I go into this CPR, I just want to make sure to everyone that how are we going to proceed with the CPR, right? So CPR content is a little bigger. I don't want to jump into the foreign body airway obstruction. I just want everyone to understand here, what do I mean by CPR? CPR means that there is a cardiopulmonary resuscitation. Okay. So you have to see and try and understand the criticality that you have to start the compressions within 30 seconds of you recognizing the cardiac arrest. As I've mentioned earlier, that you are seeing that the patient is not responding, the patient is not breathing properly, there is no pulse and no breathing. Without any hesitation, without any further delay, you have to start compressions within 10 seconds. Every second is very much important and vital to the patient to restore the heart circulation. You have to push hard and fast. Push hard and fast means that you have to compress at the rate of 100 to 120 minutes per, with a depth of 5 centimeters for the adults. And 1/3 of the chest, 1/3 of the depth of the chest should cover, that is for children. And 1/3 of the depth of chest for about 4 centimeters should cover for infants. So when you are actually doing the compressions, you have to make sure that the chest recoils after each compression, and you have to try to minimize the compressions within 10 seconds. The formula of 10 is really important, and everything that is here should be less than 10 seconds. Effective breathing, when you are actually giving the breathing to the patient, as a procedure I've mentioned with head tilt and chin lift, jaw thrust, you have to check the chest rise as well. And you have to avoid excessive ventilation. Okay. So here, foreign body airway obstruction is basically, you can grade it accordingly, whether there is mild or severity. If there is a mild obstruction, the patient is choking, patient will be actually able to say to you, yes, the patient is choking or not. If you say, if you see the patient who is only nodding and not able to speak, then that will go under the severity or severe obstruction. The other signs that you can see in mild obstruction is can speak, cough, and breathe. Whereas if there is a severe obstruction, you cannot see the patient breathe. They will be wheezing, breathing, and silently, he will try to make an attempt to cough, and then later on the patient will become unconscious. Right. So here we are talking about assessing the severity, which I've mentioned it earlier. When you are seeing the severity of the airway obstruction, the patient is not actually able to cough, which is by nature, if we get anything in our bodies, we try to throw it off by sneezing or by coughing. But if the patient is not if the patient is having ineffective coughs, then that may go into unconsciousness, then you have to immediately start CPR. And if you see that the patient is conscious, then you have to do Hamlick's maneuver, which I think I'll mention it later on. You have to give 5 back blows, or you have to give 5 abdominal thrusts. And if you are seeing that there is any mild airway obstruction, effective coughing hai, then you have to ask the patient to encourage to cough. Okay. So these are the back blows, which is in the first picture you're seeing. The second one is the procedure's name is called as Hamlick's maneuver. Okay. So this is basically abdominal thrusts that you're giving, which is again, it's called as Hamlick's maneuver. So these are the 30 compressions that you are giving. And like I said earlier, it's very important for demonstration. This is just in the picture. You have to make sure that your shoulders, your elbows, and your wrists are all all straightened up. You don't have to make any angulations at any of these joints, and you have to make sure that your wrist and your hand has to be around 90 degrees for effective breathing, for effective compressions. Sorry. Okay. So I think everyone whosoever has joined this, please appreciate the heel of one hand in the center of the chest and place the other hand on top of your chest. You have to interlock the fingers as shown, and you have to compress the chest. The rate has to be 100 minutes. Depth has to be 4 to 5 centimeters. And then equal compression with relaxation and possible. You have to change every 2 minutes when you're done with it. So possible change CPR operator every 2 minutes. So these are the diagrams actually where they're shown that why the need of putting the heel of the hand on the anterior on at least 5 centimeters, like for the adults. And the other picture is also showing that at the base of the sternum, right where the region is called is the epigastric region. I just hope I can just mention it here. Okay. Everyone, can you go back, please? Okay, so this one over here, okay, just this one out here, okay? This one. It's very important to know that your hands have to be on top of each other. Suppose if you are a right-handed person, so that becomes your dominant hand. So your dominant hand has to be at the bottom, and your non-dominant hand has to be on the top. Okay. Can we go to the next slide, please? Okay, so okay. So again, this has shown the angulation in here. The last time which I had conducted the BLS for my staff there, so I was able to demonstrate, and everyone was able to demonstrate there and there itself. I just hope that you're able to appreciate it with the pictures given in here. Okay, next slide. Okay, so 2 rescue breaths. change. Yeah. So pinching of the nose is not that very important because already you're seeing that the patient is not like breathing, but you have to take a normal breath and so and so forth. People find it very gross actually locking the lips over the other person's mouth and then giving the breathing. So there are actually some hollow tube structures are also given, like provided to the healthcare staff members, whether you're or on duty or on off duty, or you're supposed to keep it because this kind of like mishap can happen like anywhere. If you are not able to carry the hollow like tubular structures where you can place that thing into the victim's mouth, so what you do is whatever gauze pieces or whatever thing you have, just try placing it all over the patient's mouth or the victim's mouth, and then put your lips over it and then give rescue breaths. You have to actually take a deep breath and then give rescue breathing to the patient, which takes about like 1 second. And you have to make sure that the chest recoils. Okay. So, like in physiology, we have all know about the tidal volume, which is around 500 to 600 ml, which is like the maximum, right? So, giving each breath over 1 second with enough of volume to make the patient's chest rise is important. And continuously, you have to do that for at least a rate of 100 minutes. Okay. So, this is 30 compressions followed by 2 rescue breaths while continuing the CPR for a cycle of 5 and for 2 minutes. Okay. So this is the way actually to check the carotid pulse. One thing I just want to mention in here is that where you are standing on the side of the patient is important. You check on that particular side where you're standing. You don't actually have to take your hand, cross the neck, and then check for the carotid pulse, because in that way you can actually make the patient choke. It can be indeliberately, but it's more important whichever side you're standing, check the carotid pulse of that particular side, like in this case. Okay. So here is just a summary of what I have discussed about approach. Has to be safety. First, you have to make sure that you are safe, your surrounding is safe. Check the response of the patient by tapping on the shoulder, by making sure that the patient is responding. If the patient is responding, then there is no need for you to start check for breathing, or you have to start CPR and all. That's not at all needed. You have to check the response of the patient is not responding, shout out for help, and then you have to check for the breathing and then call for help, and then you have to do 30 chest compressions followed by 2 rescue breathing. Okay. So here we are actually now heading up for a defibrillation. That when do we start for a defib? So there is a device which is called as the AED. Can we go on to the next slide, which is called as the automated external device? And it actually comes with 2 patches, and it has a box where you don't have to do anything. You just have to make sure that the box is charged, and it will give the shock. It will give the shock and everything on its own. It can recognize whether the rhythm is shockable or not. Okay. So you have to make sure to attach the patch to the casualty's bare chest. Now, here, one of the things is there that suppose if you see anywhere that the area is not so clean, if you find that there is a puddle of water, so you have to make sure that the area is dry and clean. And if the patient's chest is very hairy, then you have to the machine itself like carries some like padded waxing strips where you just can apply it where the external pieces like comes with the wax strips. You just apply it, remove it, so it will take off all the hair of that particular area where you have to put the pads. Okay. So one pad is going uh, on the right top, and the other pad will go on the left top. Okay. So the machine is this is called as the automated external device, where it will recognize the rhythm on its own. So analyzing the rhythm, and when the machine is going to analyze the rhythm, so you do not have to touch the victim. Okay. So it will deliver the shock after analyzing the rhythm of the whether the rhythm is shockable or not. And then after that, the shock will be given. The machine is going to do everything. You don't have to do anything to it. Okay. Okay. So once you're going to give the shock, or the machine analyzes that it's going to give a shock, you have to stand clear, and in a count of 3, 2, 1, deliver the shock. So once the shock is given, my request to everyone here who is listening, please do not stop the CPR. Once the shock is given, you just take a minimum of less than 10 seconds to continue with the CPR and with rescue breaths. Okay. So here, this is the position of a patient who has recovered. So if you see that the patient has recovered, place the patient in this position. So this is all the different type of positions where you keep the patient who has recovered. So this is the comparison actually made between the person, between the healthcare professionals, or whosoever who is doing the CPR and whosoever is giving the defibrillation. So the points of difference, everything remains the same except for where you're giving 30 compressions, you have to attach the AED and you have to follow what the voice prompts. You have to continue CPR and the use of AED unless and until you have the qualified help arrives and takes over, and the victim starts to breathe normally. And whosoever the rescuer is becomes exhausted, should should overtake that patient, should overtake that professional, because you getting tired may be something which is like, you can get tired, but the person who is lying there is in more need of it, right? So you can't actually take that risk of you getting tired and you're not giving any effective breathing, effective CPR, and then getting tired. So basically, once the team arrives, once the help arrives, the person who is the team has to come in the vigilance and has to take over as the team, and work like a team. Like, one person can stand giving the rescue breathing, one person can stand giving the CPR, one person can stand open the IV access, one person can just stand there and observe what everybody is doing. Okay. Next. So name adult basic life support sequence of actions. So what is the maneuver? Can you go previously? So this is basically like the questions. What is the maneuver for keeping the airway open called? And the numeral combinations of chest compressions and rescue breathing in adult basic life support is, and where do you place your hands while performing the chest compressions, and how are you going to describe agonal breathing, the techniques applied in severe airway obstruction? I think this all that I've covered previously. Can I go on to the next slide? Okay. Next. So these is the maneuver for keeping the airway, head tilt and chin lift and jaw thrust. The numeral combination of chest compression and rescue breathing is 30:2. And placing your hands while performing chest compressions, where do you place it? Next. So you place the heel of one hand in the center of the chest, place the other hand on top. Interlocking of the fingers is very important. And the rate has to be 100 to 120. The depth has to be 4 to 5. Okay, when possible, change every 2 minutes. How are you going to describe agonal breathing? Next. So it's basically a barely heavy, noisy, or a gasping breathing, and which occurs, I have seen in over like 50 to 60% of patients who undergo cardiac arrest, which is quite appreciable only when you hear it. And the type of noisy, it's like you will hear it's like patient will not breathe normally. Okay, next slide. Name two techniques applied in every severe airway obstruction. So back blows, abdominal thrusts, and Hamlet's maneuver. Are we done? Okay, so hello.
Yes, Dr. Fatima, we'll be taking a question and answer session now. So I request all the participants to kindly put their queries in the question and answer box so that each and every question can be taken up. And before that, before moving on to the question and answer session, I would
So
request your permission to introduce our organization to the participants.
you're asking me?
Yeah,
Okay, so I mean, organization as in?
Dentist Channel Online.
Okay, so this is the Dentist Channel Online, which is uh, apne, so our host and host is Dr. Aditi Mishra.
Yes. So I'm just asking for your permission so that I can introduce our participants to our
Of
organization.
course. So I see this Sangya
Thank
Sharma has a lot of questions, and what is the compression to breath ratio? Uh, the compression to breath ratio is around 30:2. And the rest of the other questions I think are for from your side, I think. So sure. If patient is not, again, the question is given by Sangya Sharma. If patient is not responding to CPR, should we fracture the rib? How to assess the situation? I think even if you fracture the rib at that time is not so important, because saving the life of that particular patient is important. Because if even if you fracture the rib, that is secondarily, which can later be taken care of. The most important thing is that you have to make sure that the heart is getting enough blood so that it can pump the blood to the other organs. And suppose if you are not able to pump the blood actually to the heart, especially to the brain, then the brain has got certain cells that can go into hypoxia, that can be devoid of oxygen and can take, the cells can die like within less than 2 minutes. So I mean, if brain dies, then we cannot, I mean, the person itself is like, just goes away like that. So the main criteria is that compression on that particular site where I've mentioned earlier about with placing your heel on the base of the sternum and giving effective compressions with ventilation is to make the heart pump the blood to the rest of the other vital organs. Because if there is no pump, if there is no blood that is pumped to the other organs effectively, then death is for sure. But if without any delay, without any stop, if you are actually giving the, and without getting tired, if you are giving the compressions, then there is a chance that you can save the patient. It's a good question given by Dr. Sangya Sharma. Anything else?
Yeah, there is one question from Dr. Bhupinder. He's asking how you will recognize PT is suffering from, okay, patient is suffering from convulsions or heart problem.
I mean, how are you going to recognize patient is suffering from convulsions or a heart problem? See, heart problem is basically you can see it by attaching the patient on, by taking the patient on the monitored bed, attaching the cardiac leads to the patient, where you can actually see that the patient heart is working or not, right? Convulsions is something different. You can have a good BP, you will have a good heart rate, you will have a good saturation with a respiratory rate. So it's quite different.
Right. So moving on to the next question. Before that, I have one small presentation regarding our company. So can I do that first?
Yeah, sure.
All right. Meanwhile, I request all the participants to ask the questions, and after this PPT, we'll be taking up your questions. So
Okay.
this is our organization, Dentist Channel Online, with the motto "Healthy Smiles that lead to wealthy lives." So I request all the participants to kindly save this number and send one message, text message containing your name on WhatsApp, so that you're added to the broadcast list and you'll be updated regarding each and every upcoming events that we have. So today's webinar is sponsored by NovaMind. NovaMind is an implant company, and it offers a full spectrum of implants and prosthetic solutions that accommodate any clinical need in modern implantology. We successfully supply highly demanded dental implants types called internal hex, tissue level, bone level, and active conical connection. Their EU production unit and product quality is appreciated worldwide. Dental implants and dental restorative solution produced maintaining all the standards of EU medical device regulatory. Products are manufactured in Athens, Greece, and distributed worldwide with more than 1 million happy restorations. So quickly, let's go through the upcoming dental webinars that we have. And anyway, you can find more information on our website, events.DentistChannel.Online. So on 16th of October, we have a webinar or introduction to artificial intelligence. On 19th of October, we have with Dr. Shikha. On 20th of October, we have legal aspects part 2. Part 1 we had in the month of September, and this will be part 2. On 21st of October, we're having connecting links between oral cancer and tobacco by Dr. Kritika Bajpai. And on 22nd of October, we're having a webinar with Dr. Garima Goel on the procedural errors that we face in endodontics. We have one more webinar by Dr. Ahmed, and the host will be Dr. Sara on secrets of composite restoration. Let's move on to the upcoming workshop that we have. We have an online workshop on oral cancer by Dr. Vidhi Katira on 16th and 17th of October. Timings will be 9 to 12 p.m. and all the details you can find on our website. And if you have not subscribed to our Prime membership even now, I request you to do it ASAP. You'll be getting added benefits. You'll be receiving certificate for each and every webinar that you attend. You'll be getting discounts for the workshops and a lot more. So the annual membership will cost you just 499 rupees. You visit our website to enroll. You can follow us on Facebook, Instagram, Twitter, and YouTube. Now, let's move on to the question and answer session. So, okay.
I think all the questions and answers are done. I think there's no question has been set in the
Okay, that's
chat.
perfect then. So before closing the session, any takeaway note for the participants?
There is a question which is given by Aisha Nazhat, I think. She's asking whether we can do this course from BLS ACLS course. This course is actually provided by AHA and can be done by any institutions. So what I'll do, Aditi, is that I'm going to give you the number of the person who actually organizes this, and then where you can contact that person, and whoever is interested from your organization can come up to that person and then do it, right? So
Yes,
I think
absolutely.
everybody, I think BLS is mandatory for anyone. It's not necessarily needed whether you have to be a health professional. You know, it's mandatory for anyone. And this is basically a demonstration class, where you cannot actually present things on just on the slides. The like the last time I had taken up the course, taken up the presentation in my hospital. So each and every one was like made to do CPR and just demonstrate and all. And you need certain corrections, putting where you have to put the heel of the hand, and how much base you have to go, with what depth you have to go. So I'll do that. I'll have certain people numbers where I'll share it with you, so you can share it with your people. Okay.
Yes, absolutely. Thank you so much, Dr. Fatima, for this amazing session. Looking
Oh,
forward for
you're
more.
welcome.
All right. So with this, we are ending this session. Thank you so much to all the participants. Have a great evening ahead. Thank you so much.
And thank you for having me, Dr. Aditi. Bye. Take care.
Bye bye.